The decision to become a nurse comes from deep inside. It is a calling. It's part of your DNA and has probably been with you for as long as you can remember. Growing up, it's the part of you that wanted to save that injured little bird, soothe a crying baby, or help your grandmother take her medicine. You were born to care for people. Now that you're part of the world's most trusted profession, it's your job to take care of those in need. But sometimes, nurses need help too. That's where we at the Louisiana State Board of Nursing come in. We offer a variety of services, one of which is the Recovering Nurse Program, a program that helps healthcare professionals who suffer from addiction to alcohol, drugs, and especially opioids. We're here to let you know if you ever need, we're here to help.
Hi, I'm Nikki Honore, statewide nurse program consultant at the Bureau of Community Preparedness at the Louisiana Department of Health. As you probably are aware, opioid addiction continues to be a problem for the United States and also Louisiana. Over half of you probably know a family, a friend, a relative, or a coworker that struggles with prescription opioid addiction. Opioid addiction reaches far beyond the stereotypical addict or drug seeker. More than half of individuals report using opioid prescriptions for family members who have a written prescription for those opioid drugs. Nearly 40% of employers said employees are missing work due to the abuse of painkillers, with roughly the same percent reporting employee abuse of the drugs on the job.
Unfortunately, the nursing profession has seen an increase as well, and there are a number of reasons. Nurses obviously have greater accessibility to medications. They work in critical care areas. They experience a great deal of work-related stress and sometimes depression. They have an expertise regarding medications and the aiding of coworkers. As a nurse, no one enters this profession looking to become addicted to opioids or other substances. It's usually a gradual progression, but one with grave consequences for the nurse, his or her coworkers, and potentially the patients we've taken an oath to protect.
Nursing has been voted the most trusted profession for many years. When a nurse comes to work, he or she has to be clear-minded and not impaired. If a nurse is impaired, that decision-making, the critical thinking skills necessary to adequately care for patients can be compromised. Medication errors can occur, reporting or charting errors can happen, and ultimately, patients can be injured. That breaks the bond of trust that the community has in us.
Luckily, the Louisiana State Board of Nursing is here with a program that can help.
My name is Yolanda Beckwith. I am the Director of the Recovery Nurse Program and Monitoring at Louisiana State Board of Nursing. One way we assist nurses is through the Recovering Nurse Program, also known as the RNP. The RNP was developed, first of all, to protect the consumers of healthcare in Louisiana, while allowing advanced practice registered nurses, and student nurses who may be dealing with a substance use disorder or a medical, mental, or physical condition to maintain their license or obtain their license while being closely monitored by the board through a board order agreement or a consent order. The RNP is a voluntary 5-year program, and the nurse has to submit to an inpatient evaluation at one of our board-recognized treatment facilities. And once they have been diagnosed with a moderate or severe substance use disorder and/or a medical, mental, or physical condition, it will require the nurse to have ongoing medical care and monitoring by the board as they go through the RNP program.
Like we mentioned, no one thinks that becoming addicted to opioids or other substances lies in their future, but it can happen. Thankfully, the Recovering Nurse Program has helped hundreds of nurses recover from addiction while also keeping their jobs. It truly changes lives. Just listen to the story of Lisa Booth, who completed the program and now has over 20 years of sobriety.
Hi, I'm Lisa. For me, the disease of addiction was progressive, like it is for most people. I didn't go into nursing to be an addict or an alcoholic. It just happened. When I was young, I started drinking. It was fun, but then it became a problem. I wrecked more than one car. I missed work. I embarrassed myself, and I put myself and others at risk. Eventually, I found that after drinking at night, a pain pill would help me feel better during the day. That was the beginning of the end for me. I quickly became physically addicted, which had never happened with alcohol. There's a special kind of guilt and shame for a nurse who knows she's doing wrong. Whether you're working impaired and telling yourself you're not, or you're taking medications that don't belong to you, like I was. Nurses don't come to the R&P or the board voluntarily. Usually there's a law enforcement incident, a family member incident, or an employment incident that brings them to us. My incident was the same. I had a seizure at work in front of my friends and colleagues that trusted and respected me. I lay there face down on the floor having violent muscle contractions and losing consciousness. I had to be transported to the emergency room by ambulance, and the nurses there and my employer told me to call R&P. The first way the R&P helped me was guiding me to special treatment centers that are experienced in helping healthcare professionals. They know that the disease of addiction is deep-rooted. They not only treat the drug and alcohol use, they treat the deep-rooted problems that cause the addiction. They say that addiction is a disease of denial, and that was me. I didn't realize how unmanageable my life was. The RNP provided a structure for me. It made me learn how to take care of myself. When I got out of treatment, I knew that I had a problem. I knew that I needed to stay sober, and I knew what I should do going forward. But I don't know how long I would have continued that unless I had the RNP supporting me and asking me to do the requirements that led me to a better life. By the time I got out of the RNP, those requirements had become a way of life. And my life was so much better that I didn't want to stop doing those things. It sounds cliche, but today I have a life that I never could have imagined. I work with Yolanda at the Recovering Nurse Program and Monitoring Department. I went to work for RNP because I thought that much of the program. So today, when a nurse calls and she's in trouble, I can reassure her that it's not the end of the world. It's not the end of her nursing career. I can give her hope that there is light at the end of the tunnel, and I've been where she has. And that part of my job, I love. This year, I'm excited to say I'm retiring, and I'm blessed and grateful I'll have 20 years of sobriety. So next year, I'll be able to take trips, I'll be able to work in my garden, and I can spend more time with my grandchildren.
As you can see, the Recovering Nurse Program has helped healthcare professionals across the state to get better. And the relapse rate for the RNP is very low in comparison with the general public, which is a testament to the quality counseling and care you receive from our staff. As we've said before, we hope you never need this program. But if you do, it's here for you and it works. If you feel you need help, please don't hesitate to contact the Recovering Nurse Program. For more information, visit the Louisiana State Board of Nursing website at lsbn.state.la.us or call 225-755-7500. Remember, we're here for you if you need.